Mesenteric thrombosis and pulmonary thromboembolism secondary to the antiphospholipid syndrome case report. The antiphospholipid syndrome is defined as the associates between recurrent arterial or venous thrombosis and pregnancy morbidity, including fetal loss associated with the presence of antiphospholipid antibodies as well as cofactors such as beta-2 glycoprotein 1 and protein. The ratio of films to males in abs is 3:1. Male patients with abs predominantly have vascular thrombosis, thrombocytopenia, pulmonary thromboembolism, and stroke. Future 1 is the causes of permanent or organ damage, myocardial infarct, mesenteric thrombosis, stroke, and pulmonary thromboembolism. The objective is to present a case of male patient with the two thrombotic events. Clinical case: a 38 years old male patient with cochlear pain in epigastrium without irradiation and nausea with the emesis was admitted. 2 days later, the pain increased 8 of 10 of intensity with irradiation to the right eye and was increased with movement and tuning at the rest. A diagnosis of acute inflammatory abdomen was made. Laparotomy was performed and thrombosis in the right colic artery was found and radiomyocolectomy was practiced. 34 hours later, the patient had sudden cold attack with the mating sputum, decreased respiratory movements and basal crickets. CT angiography with thrombus in the right main branch that occluded 70% of its caliber, right pleural effusion. Abdominal radiography and future 3. Intestinal lobe dilatation secondary to a mesenteric thrombosis. Anti-laboratories, anti-beta-2 glycoprotein (IgM) is positive. Conclusion: the following risk factors to recurrence in patients with unprovoked pulmonary embolism might help to identify those at the higher long-term relative risk of recurrence. 1 or more previous episodes of venous thromboembolism, antiphospholipid antibody syndrome, hereditary thrombophilia, or residual thrombosis in the proximal veins. A retrospective study showed that the patient with the first unprovoked pulmonary embolism who had hemoptysis are 8, minor to 40 years, had a low PSI risk class 1 or 2, and unprolonged APTT should be suspected and having syndrome, antiphospholipid antibody syndrome, and should undergo laboratory. Thanks.